Did you know that October is Breast Cancer Awareness Month? The American Cancer Society in 2012 says that 1 in 8 women will develop invasive breast cancer during the duration of their lifetime. So everyone in this room will know somebody who has been affected by breast cancer. Guys, I know you're thinking that this has nothing to do with you, but that's not the case. In fact, men can get breast cancer, and being aware can help you save the life of your mother, your sister, your daughter, your wife, or your friend. Breast cancer can be traced back to ancient Egypt, where it was first documented in 1600 BC on the Edwin Smith Papyrus. My grandma Douglas was diagnosed with breast cancer at the age of 47. She was able to undergo treatment and get the cancer removed. 12 years later, she had breast cancer again, but they didn't catch it at an early stage. I was pregnant with my oldest child at this time, and she wanted so badly to see him that she went through chemotherapy, but it was unsuccessful. In October 2008, she passed away just 3 months short of meeting my first son. My kids know her like she was alive still today, and they know how strong of a woman she was. Today, I'm going to inform you of the basic facts of breast cancer, some risk factors, and some symptoms involved in breast cancer. My first main point is the basic facts of breast cancer. The National Breast Cancer Foundation says that breast cancer is a disease in which malignant cells form in the breast tissue. Breast cancer is the second leading cause of cancer death among women, but the most commonly diagnosed. The most common forms of breast cancer are invasive ductal carcinoma, where the cancer cells grow outside the ducts in the breast. Invasive lobular carcinoma is where the cancer cells spread from the lobules into the breast tissue. There are 5 stages of breast cancer. Stage 0 is non-invasive breast cancer. Stage 1 is the early stage. It's where the cancer has spread to small tissues inside the breast. Stage 2 is localized. This is where the tumor is between 20 millimeters and 50 millimeters, and there are lymph nodes involved. Or the tumor is larger than 50 millimeters with no lymph nodes involved. Stage 3 is regional spread. This is where the tumor is larger than 50 millimeters, and there are more lymph nodes involved over a wider region. The cancer may have spread to the chest wall or the skin at this point. Stage 4 is distant spread. This is where the cancer has spread beyond the breast into other parts of the body. Since we now know what breast cancer is and some facts about it, let's look at some of the risk factors. There are risk factors that you cannot change, like getting older, your genetic mutations, if you have family history of breast cancer, you have dense breasts, or your menstrual cycle started before the age of 12. Some risk factors you can change is being physically active, not being physically active, being overweight or obese after menopause, taking hormones, or drinking alcohol. The Centers for Disease Control and Prevention says you can lower your risk by keeping a healthy weight, exercising regularly, not drinking alcohol or limiting your alcohol intake to 1 drink per day, breastfeed your children if possible, or if you have a family history of breast cancer, consult your doctor and ask them how you can lower your risk. Now that you are aware of some risk factors, let's look at some symptoms to look out for. According to the Cancer Treatment Centers of America, the most recognized symptom is a lump or mass in the breast. Some common early warning signs are skin changes like swelling or redness in 1 or both breasts, increase in size of 1 or both breasts, the change of shape in 1 or both breasts, the change in appearance of 1 or both nipples, nipple discharge other than breast milk, general pain in or on your breasts, irritated or itchy breasts, peeling or flaking of your nipple skin, nipple retraction, which means your nipple turns inward. It is recommended that you give yourself a breast examination at least 1 time per month to check for any of these symptoms. Today I have informed you of the basic facts of breast cancer, some risk factors, and some symptoms to look out for. Breast cancer is a serious matter all around the world. Some are more susceptible than others, and knowing your family history and consulting your doctor are extremely important. What's also important is to familiarize yourself with how your breasts normally look and feel so that you can notice any changes and consult your doctor. Understanding breast cancer can help people become more aware and help themselves or others. If you or someone you know are experiencing any of the symptoms I previously stated, please go to your doctor to get these checked out. It's better to be safe or sorry. Thank you.